So it's now my honor to have Ms. Punya Srivastava, Secretary of Health, join us this evening. So I'm going to invite Ms. Neelima Dwivedi to introduce the Honorable Secretary. Ms. Dwivedi is the Executive Director of Public Policy and Market Access at MSD Pharmaceuticals.
Good evening, everyone. As I was introduced, I am Neelima Dwivedi and I lead corporate affairs function for MSD Pharmaceutical. MSD Pharmaceutical is a global biopharmaceutical company, truly, in fact, committed on patient and access to innovative medicines and vaccines. And it's really my honor to introduce Madam Punya Salila Srivastava, our Health Secretary. So this is really my honor. But before I introduce ma'am, I would like to initially, first of all, talk about, in fact, a little bit about the healthcare industry as a context setting. So the Indian healthcare sector is at a crucial juncture. Over the past few years, in fact, the government has made commendable progress. The first one, and I remember in 2013, when I had joined this industry, there used to be discussion in all the policy forum on universal health coverage. And now we have universal health coverage as Ayushman Bharat initiative, which is one of the largest, world's largest universal health coverage, covering more than 550 million, I believe, people. And now it is also getting extended to the senior citizen above 70 years of age. So this is really a great progress in policy space. In addition to that, when we talk about US-India collaboration, one of the key things which happened recently is under Quad was the launch of Cancer Moonshot program. Cancer Moonshot program, again, leveraging public and private resources to reduce the disease burden in Indo-Pacific region, and also the lives which are lost because of the cancer. How can we really reduce the burden? So that's the other thing where US-India collaboration is really working, and during our Prime Minister visit, it was announced in the US with the initial focus on HPV vaccination, HPV and cervical cancer. And few of the key commitments which India has made is the detecting tool for HPV. In addition to that, also in treatment and this HPV vaccination for the Indo-Pacific region. In addition to this, on behalf of pharmaceutical industry, I would like to just mention and appreciate government's effort in providing enabling policy environment to all of us, to the entire industry. And one of the key things which I would like to cite here, the recent announcement of basic custom duty exemption for life-saving drug is one of them, ma'am, which is really a welcome step taken by the government for industry. In addition to that, also the commitment towards preventive health care. There was also announcement made last year for including HPV vaccination for the girls. That is, again, the industry is really excited about it, because if we really want to eliminate cervical cancer, again, one, of course, working through Quad and Cancer Moonshot program, but the other one, even in India, India has one of the highest disease burden. I think bringing HPV vaccination under National Immunization Program is really a very, very exciting and great step, and we are really waiting for the implementation of that project. In addition to that, also, if you look at the regulatory side, there has been some very, very positive development. And one of the key one, and mostly I would just cite the latest one, is acceleration of the new drug launches. The drugs which have been launched in the other market can be accelerated now under Rule 101 and can be brought in India. This is really a great thing especially to provide access to our patient. So these are a few of the things which I wanted to mention before I go to your illustrious career. So Madam Punya Salila Srivastava joined Indian Administrative Service in 1993 and is currently in the Ministry of Health and Family Welfare, Government of India, leading initiatives aimed at improving health and healthcare delivery system. Before assuming this charge, Madam Srivastava was officer on special duty in Ministry of Health in the rank and pay of Secretary, Government of India. Prior to joining Ministry of Health, Madam Srivastava was Special Secretary at the Prime Minister Office. With a distinguished career spanning over 30 years in Indian Administrative Service, Madam Srivastava has held a range of crucial positions across various levels of governance. Madam Srivastava has served in pivotal role including Deputy Commissioner, Commissioner, Directors at state level and at Union Territory levels. And she has worked in Ministry of Home Affairs as Joint Secretary and Additional Secretary, and later on at the Prime Minister Office as Additional Secretary and Special Secretary. In addition to her dynamic professional career, Madam Srivastava is a distinguished alumna of St. Stephen College, Delhi University. She completed both her graduation and post-graduation in physics, and which lays a strong academic foundation for which really complements her public sector career. Madam has done Masters in Public Management from University of Maryland, USA. And as we look into the future of healthcare, it's not today, but even in the future, it is really going to be the most important and going to contribute in every aspect of Viksit Bharat. And ma'am, we really look forward to your leadership in continuing in this direction and strengthening healthcare ecosystem in India further. And with this, I invite you for your special address.
So, Dr. Mukesh Aghi, President and CEO of the US-India Strategic Partnership Forum, my colleagues here, distinguished guests, ladies and gentlemen, good evening, and thank you for this opportunity to speak at the US-India Strategic Partnership Forum. It's been a long day for all of you. My day also started with some of the colleagues here at the International Conference of Drug Regulatory Authority, so it's been a long day for all of us. But I am so happy to be here and that you all are here to discuss this important issue of building a resilient US-India partnership for global health security. So India and US are natural partners, vibrant democracies with flourishing academia and research institutions, common goals and values, and most importantly, a shared vision for the welfare of humanity based on the principles of equity, access, and mutual benefits. Friends, I believe that the greatest challenge to global health security arises from a mix of human, animal, and environmental factors. Population growth, rapid urbanization, environmental pollution, climate change, increasing antimicrobial resistance, and increasing risk of zoonotic diseases all threaten national and global health security. India, because of its huge population and mobile demography, has been tackling challenges such as providing healthcare infrastructure to cater to its diverse healthcare needs, interspersed over rural and urban areas, and a geographic spread that encompasses mountain and hilly terrains, great stretches of coastal areas, desert regions, forested areas, and other hard-to-reach areas. And expanding infrastructure as a result of rapid urbanization, climate change, and changing lifestyle habits makes India susceptible to both communicable and now more so non-communicable diseases. At the same time, we are tackling issues such as out-of-pocket expenditure due to lack of adequate insurance and rising costs of healthcare services, which may lead to many households facing unwarranted financial stress. With the integration of India into global economy, there has been increase in mobility of people and goods, transcending national and natural borders. No country is immune from health challenges that affect the other parts of the world, and the COVID-19 pandemic was a testament to this. India is determined to learn from the pains and challenges of the COVID-19 pandemic and to rebuild our lives, our economy, and strengthen our health infrastructure and services to meet any future challenges. In fact, the slight delay that I apologize for today evening was because of a meeting on this subject. Friends, India has always prioritized its healthcare security, and therefore, under the leadership of the Honorable Prime Minister Shri Narendra Modi ji, the Pradhan Mantri Jan Arogya Yojana that Neelima ji referred to was launched in 2018. This is what we call a centrally sponsored scheme, which is the world's largest health assurance scheme for tertiary care, and it provides health coverage to over 120 million poor and vulnerable families. It provides benefits, as Neelima ji mentioned, to an estimated 550 million beneficiaries, which is approximately the most vulnerable, the economically disadvantaged 40% of the Indian population. This year in September, the Government of India has expanded this to all senior citizens aged 70 and above, regardless of their gender, income, and family size. So this will benefit 45 million families, including 60 million elderly population. This reflects our commitment to the healthcare needs of our elderly citizens who make up a large part of our country's population. To secure the health systems of any country, it is important to ensure adequate availability of skilled and competent human resources for health, who are at the core of combating healthcare challenges. So it gives me great pleasure to inform you that in the last decade, India has introduced many reforms in the sector of medical education. The Indian Medical Council has been replaced by the National Medical Commission. In 2021, government has passed two important legislations, the Nursing and Midwifery Commission Act and the National Dental Commission Act. So we are taking steps in bringing regulatory reform so that we set the educational standards that are uniform across the country and incorporate global level of competencies. So these reforms are also aimed at ensuring human resources, not just for our country, but to meet global needs. And in line with Government of India's commitment, we have sanctioned setting up of 157 medical colleges in those districts in India where there were no medical colleges. And now we are co-locating nursing colleges with these medical colleges. In the last decade, the number of seats for our undergraduate courses has grown up by 110% to over 100,000 seats in 2013-24. Similarly, the postgraduate seats in the last decade have increased by 118% to nearly 70,000 in 2023-24. We acknowledge that healthcare professionals from India, whether doctors, dentists, nurses, pharmacists, or other allied health workforce, contribute greatly to our country and also contribute with their commitment and dedication in other countries where they serve, including the USA. Our healthcare professionals are valued for their skills and competencies, and especially for the compassion and care of the Indian ethos that they embody and represent. As Madam mentioned, our investment in the pharmaceutical sector has ensured India's emergence as one of the global leaders in research and innovation, driven by a combination of robust scientific and technological base, strong government commitment and support, a thriving domestic market, and a cost-competitive manufacturing with adherence to global standards. As a result of it, the pharmaceuticals and medical device sector has become the fourth largest export sector in the country, and many of the contributors are there in this hall. India is the third largest producer of pharmaceutical products worldwide. India is also the largest provider of generic medicines globally, occupying a 20% share in global supply by volume, and the major supplier to both highly regulated markets and to low and middle income countries. Access to affordable antiretroviral treatment is one of the greatest success stories in modern medicine, and India is proud to play a significant role in this narrative, with more than 70% of the global requirements of quality antiretroviral medicines being provided by India. Because of the low price and high quality, Indian medicines and vaccines are preferred worldwide, making it the pharmacy of the world. 50% of all vaccines manufactured in the world are from India, and my colleagues who are there in the morning would be aware that 8 billion vaccine doses which are manufactured and distributed across the world. Of this, 4 billion doses were manufactured in India. So the contribution of the Indian pharmaceutical industry is evidenced by the fact that India has the highest number of US FDA approved pharmaceutical plants outside of the US. And I'm told that 219 billion US dollars saving to the US healthcare system in 2022, and a total of 1.3 trillion US dollars savings between 2013 to 2022 are attributable to medicines from Indian companies. In the context of India, our efforts have ensured that the healthcare Indians receive has progressively improved in quality, scale, and most importantly, in cost effectiveness. A study shows that the out-of-pocket expenditure, which is borne entirely by the households, has declined by 25 percentage points as a share of the total health expenditure over the last 10 years. Several initiatives, including the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, our Ayushman Arogya Mandir. Some of you, if you have a time, do visit some of them. Improving health infrastructure through the Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, and telemedicine through eSanjeevani have contributed to this positive shift and have brought essential healthcare services closer to rural communities, reducing the need for costly hospital visits. The strong India-US partnership in health sector is an example of how two strong nations can work together for the greater common good. The Indo-US Health Dialogue has been institutionalized since 2010 and has yielded several tangible results and ensured that the field of healthcare remains at the core of our engagement. We possess a multifaceted collaboration that aims to leverage each country's strength to address pressing health challenges, enhance healthcare delivery, and improve healthcare outcomes for their populations. The 6th Indo-US Health Dialogue took place in 2023, and we welcome our American friends for the next edition in 2025, which will be hosted in India. The 77th World Health Assembly has agreed on amendments to the International Health Regulations of 2005, aiming to improve global health security by strengthening core capacities like disease surveillance, laboratory strengthening, and other services to improve detection, timely reporting, and response to public health emergencies. And for this, we have to thank the American side for their cooperation in getting these amendments through. We are also thankful for the opportunity that India received to participating in observing the joint external evaluation of the US earlier this year. And we hope to augment our own surveillance and public health response capabilities using these observed experiences. Our mutual and shared priorities in the field of surveillance, pandemic preparedness, and antimicrobial resistance are underscored in the deep partnership between our National Center for Disease Control and the US CDC. So I'll add to some of the points that Ms. Dwivedi mentioned. India appreciates the NCDC and the ICMR Field Epidemiology Training Program, which was organized in collaboration with the US CDC, and over 200 epidemic intelligence services officers have been trained so far, with another 50 currently undergoing training through various programs. So as we upgrade our integrated public health laboratories and expand our capacities in surveillance and epidemiological studies, we will continue to engage with the US CDC. And the other sector where we've had a lot of cooperation is in developing resilient supply chains. And India's place as the pharmacy of the world complements United States' place as the research and innovation driver of the world. And our unique strengths provide us with yet another example of how both nations can work together. I'm happy to also note that India and US have agreed to initiate a joint strategic framework for optimizing the biopharmaceutical supply chain and for optimizing and strengthening global supply chains and to reduce dependencies on single source suppliers through the Bio5 Alliance. Together with our friends in the EU, South Korea, and Japan, I believe that this alliance will persevere in its ambitious goals to ensure that the supply of raw materials, medicines, and vaccines are not disrupted in times of need. Further, as a part of the Indo-US Pharmaceutical Partnership, India and US have agreed to contribute to developing modern infrastructure, including production units, warehousing, and logistic facilities within the bulk drug parks which are being set up across the country. So we intend to collaborate in R&D, invest in quality control and testing, and to promote green manufacturing. Our leaders have understood the impact of cancer and its role on public health, as Ms. Dwivedi mentioned. And in 2023, Honorable Prime Minister Shri Narendra Modi ji and President Biden announced their commitment to accelerate the fight against cancer. This was the genesis of the India-US Cancer Dialogue, which stands testimony to our combined efforts, leading to the first ever US-India Cancer Moonshot Dialogue launched this year in August. Partnering with the Department of Health Research and Department of Biotechnology here in India, this dialogue focuses on strengthening US-India biomedical research cooperation and jointly developing solutions to improve the health and well-being of the global community with a special focus on cervical cancer. It is indeed heartwarming to note that these partnerships have transcended the governmental sphere by involving individual research institutions, academia, and centers of excellence such as AIIMS and Tata Memorial Hospital. This initiative has expanded into the Quad Cancer Moonshot Initiative. Honorable Prime Minister, in keeping with India's vision of One World, One Health, has announced the dedication of a grant of $7.5 million to cancer testing, screening, and diagnostics in the Indo-Pacific region. As a partner of Quad, India will provide support for radiotherapy treatment and capacity building for cancer prevention in the Indo-Pacific. Several Indo-Pacific countries will supply from the supply of 40 million doses of vaccine from India under the Gavi and the Quad programs. We hope to continue this work with all the other nations. Going forward, we feel that India and US can collaborate to strengthen global health security by focusing on some key areas such as research and development in low-cost and rapid diagnostics to support disease surveillance. Our collective effort should be on public-private partnerships that can advance our common objectives of scalability, quality, affordability, and accessibility. Our partnership and investment in disaster-resilient and climate-resilient health infrastructure can also ensure that we develop low-cost models that can benefit the world and help us collectively fight future climate change-related challenges. Our capacities in technology and digital advancements, along with the know-how we possess, strategically position our nations to build digital public health infrastructure for our nations and the world, so that we can use the technologies and digital tools to cut down costs, expand the reach of our services, and ensure, most importantly, equitable access. In addition, we can also work together to expand the Indo-US Vaccine Action Program, leverage India's manufacturing capabilities through technology transfer, joint research, and innovative clinical trial designs. So, as you're aware, our Honorable Prime Minister Shri Narendra Modi ji advocates Sabka Saath, Sabka Vikas, Sabka Vishwas, Sabka Prayas, which literally translates to involvement of all, development of all, trust of all, and efforts of all. This envisages unity in addressing global challenges, fostering inclusive, human-centric growth, building trust by acknowledging aspirations, and harnessing each other's strength for global good. I believe that strong India-US partnership can serve to benefit not just our two nations, but would serve for the greater good of humanity. I call upon the participants and friends here from both the countries to intensify joint activities and investments in key areas such as research, technology transfer, capacity building, and human resources for health, and strengthen this partnership to realize our shared goals. The Government of India, Ministry of Health and Family Welfare, will welcome all such initiatives and do our best to facilitate whatever you take up. India believes, as you are aware, in Vasudev Kutumbakam, which is a philosophy that the whole world is one family. Hence, we believe that the security of all depends on the security of each one. And it is in the interest of India, it is in the interest of US, and in the interest of the world that we continue to progress in this partnership. I thank you for this opportunity and wish you all the best. Jai Hind.